Hi everybody, I'm Rick Swanky, Hovespian. Well, here we are, an absolutely glorious day in Santa Barbara. I'm here at East Beach. The yachts are in the harbor. The tourists are on Stearns Wharf. But you know what? A dichotomy exists here in Santa Barbara. There's an estimated 4,000 to 6,000 homeless individuals in Santa Barbara County. There's a very interesting group doing truly humanitarian work just 1 block away from this picture postcard image that you're seeing right now. Let's take a walk over to Pershing Park and check in with the group from Doctors Without Walls. Okay, so here we are right across the street from the harbor at Pershing Park, Plaza del Mar, the amphitheater here, where every Wednesday night the Doctors Without Walls people are here giving very badly needed medical assistance to the homeless population in our city. As a matter of fact, I think it's time to get unswanky for this occasion. We're not at the polo fields anymore, folks. This is the city you live in, and these folks are doing some wonderful things to help our population. Come on. Okay, I am joined here now by Krister Brady. Krister is a very dedicated young man and a true young humanitarian. I'm proud to know him and call him my friend. Krister, what's your position with Doctors Without Walls? Give us the whole deal.
Yeah, I'm the program coordinator with Doctors Without Walls, and I help to organize the volunteers, organize our 2 weekly clinics, and I help organize the women's clinic.
You mentioned 2 weekly clinics. You do the one here in Pershing Park in downtown Santa Barbara, and what's the other?
The other in Isla Vista on Monday nights around the same time. That it also coincides with a meal that's served out there.
In addition to that, you have a women's clinic or something as well, right?
Yeah, that's the 2nd and 4th Fridays of every month, and that's during the day. It's from about 9 until 2 o'clock, and it's a place that's just for women who are living on the street, and it's a place where they can take showers. We do have our medical clinic there as well, but there's food there. We partner with the Organic Soup Kitchen, also with the Transition House, and that's where we have the women's clinic.
Sort of a matter of feeling human again.
Exactly.
I understand you even have a Diva Day there. Is that correct? Where the women
we had
can
one last year, and we're having another Diva Day in late April.
That must really lift their spirits, Krister.
Yeah.
So tell me some nuts and bolts about Doctors Without Walls here at Pershing, since we are here tonight. What's the procedure? People come up to, I see a table here with some necessities. Give me the ins and outs.
Yeah, people can come directly to the table and let us know their medical needs. But then we also go to the patients as they're standing in line. If they have a need, we say, we're a team of doctors here. We offer free medical care, and so if you need anything, let us know. We're going to have 2 doctors that come, and so we do that even before the doctors get here usually.
I see.
And then the doctors will be seen, and then once we finish here, we go out on street rounds, and so we have different routes that we take throughout town, and that's a multidisciplinary
outreach,
team.
In other words, to the homeless themselves.
That's right. Yeah.
And you have the backpack medicine then. Is that correct?
Exactly.
Right.
Yeah. Backpack-based medicine is what sort of street medicine is based on.
And let's give the website right now, lest we forget, but it's santabarbarastreetmedicine.org. Is that correct?
Right. That's exactly right. Yeah. We have a new site coming out in the next couple weeks, actually, so with updated photos and stories.
Excellent. How many doctors and RNs, et cetera, do you usually have on hand here volunteering their time?
In Pershing Park, we have at least 2 doctors all the time, and then our RNs, 3, sometimes 4, and then medical assistants, and even scribes, some that work in the emergency room.
I do notice a lot of young, evidently college students, probably from UCSB. Tell me a little bit about them, and I'm going to certainly interview some of them as well.
Yeah, I think any street medicine program is really bolstered by enthusiasm, and that you find that in pre-med students, and they're so eager to be out here, and that tied in with the training that we're able to do with outreach training. This is really unique work that we do, and that with the scribe training, so they get a really basic set of tools for talking with the doctor and with the patient, being that connection. And because students are young and really enthusiastic. They're a great bridge between the patients and the healthcare system, which in this case is a doctor out on the street.
Right, absolutely.
Yeah.
Are you pre-med yourself?
I
Is
am.
that your
Yep.
intention to be
Yep.
a doctor?
To be, yep.
Well, I can't think of a young man that would be a finer one.
Thanks, Rick.
Christopher Brady, again, proud to know this young man. Christopher Brady, everybody. I'm here with one of the other physicians on call here at Pershing Park on this Wednesday night, Dr. Laura Polito. Doctor, how long have you been involved with Doctors Without Walls? Tell me a bit about your normal practice, if you will, as well.
I've been involved for about a year and a half. I normally, my day job, I'm at Sansom Clinic and I do family medicine.
Great.
And then I'm out here every Wednesday night.
How many years have you been involved in this?
Just about a year and a half, actually.
Right.
So not very long.
Great. I'm sure it's very fulfilling to come out here and know that you're truly helping these folks in need that are hard pressed to find medical attention elsewhere.
Yeah, absolutely. It is absolutely the best part of my week. I look forward to Wednesday nights. I really do.
Even more so than your kids?
Okay, not more than my kids, but
Doctor,
other than that.
And you know, everyone's talking about Dr. Mimi Doohan. What kind of inspiration has Mimi been to you?
Mimi is just an amazing, amazing person. She's the one who first got me involved in this, and she's the one that started the whole thing, and just has been a great mentor to me, and is one of the most hardworking and giving people I have ever met.
I couldn't agree more. Thank you so much, Dr. Laura Polito, for all of the good work that you do here on Pershing Park on Wednesday nights. You're welcome. Okay, I'm here with Dr. Bob Gaines. Bob, tell me a little bit about your normal practice and then how you got involved with the Doctors Without Walls group.
Well, normally I'm an internist and I work for the Veterans Administration. And I just heard Mimi talk about the homeless situation in Santa Barbara, and she was looking for recruits. So about 4 years ago, I thought this would be a great thing to do to give back to the community and also to help any veterans that may happen to be homeless.
Which I'm sure that there are several homeless veteran population.
We see a lot.
Yeah.
We think about 25% are homeless, so we try to help them out, try to get them to the clinic, we try to keep people out of the hospital and out of the emergency room and healthy.
Right. And are you, as an MD, are you able to prescribe prescriptions for these folks, or do they go away after a visit with antibiotics, etc., or what?
We don't write prescriptions, but we have medicines with us. So we don't have narcotics. We have lots of antibiotics, antihypertensive medicines, diabetic medications, and our hope is that we can. Most of the problems we see are infections. Treat the infections before they become sick, septic, and in the hospital. So we have a whole backpack. When you get the picture, we have all kinds of backpacks full of medications, eye medications, ear, skin infections, bronchitis.
Right. What are some of the typical things that you'll see here? A lot of feet problems, I understand.
Well, a lot of skin problems.
A lot of skin.
And a lot of infections with MRSA. So we have a lot of resistant bacteria. We see a lot of that. We see a lot of bronchitises and asthmas, feet infections, ear infections.
And you're here just about every Wednesday, aren't you, Doctor?
Most Wednesdays we're here. Yeah. Okay, happy to do that.
Salt of the proverbial earth right here, Dr. Bob Gaines.
Thank you.
I'm here with Allison Nuovo, and Allison, I've seen you at a lot of the meetings, the Doctors Without Walls meeting, but I come to understand that this is your first Wednesday night here at Pershing.
Yeah, this is my first Wednesday at Pershing.
Well, what's your first impression of all the good that's going on here?
That it's fantastic. I love seeing everyone, all the familiar faces out here, and a lot of faces I haven't seen before.
Have you been involved with the women's clinic before?
Mostly
or?
with the women's clinic, that's for sure.
And tell me again the details on the women's clinic. It's every other Friday.
It's the second and fourth Friday of the month, and we do it out of the Transition House off of East Ortega,
right?
Downtown.
Okay, great. And tell me a little bit about yourself. You're a pre-med student, are you? Or?
I am actually. I just got into medical school.
Oh
so
my God!
Thank you.
The world's a better place already.
I guess so.
Congratulations! That's so awesome. Where are you going to go?
Well, I haven't made a decision yet, but it's between Ohio State University and Vermont so far. So,
that's wonderful. That's great news. Congratulations. Another great doctor to help the world. Allison Nuovo, congratulations.
Thank you.
Okay.